Thank you for coming. Chinese pulse diagnosis is really not something you learn here at school, or at any school, or even in China or Taiwan. In the 1950s, when Mao came in, he wanted to put a dialectical imprint on Chinese medicine, basically a Marxist dialectical imprint. So everybody talked about pulse diagnosis. There were some great doctors. And so they put a number of, and I don't know how many, but it was at least 6 people. I learned this story from Dr. Hammer. And they had patients who were already diagnosed by Western doctors with very specific problems. And so each doctor, not knowing anything about the patient, took the pulses and came up with their own diagnosis based on Chinese medicine within usually their own family schools of Chinese medicine. And everybody came up with a different diagnosis. And the powers that be decided this will not work. And so they threw out pulse diagnosis except for the most rudimentary aspects. And this is what I learned, and this is what you are learning. You know, everything is fast, slow, bowstring, choppy, tight, or tense. And that's it. And then you have to figure out what those qualities, and slippery. You have to figure out what those qualities are. No one's really showing you. So what happened, I mean, is that in throwing that out, they developed something called differential diagnosis, which is really a Western model, and which is very good. They've really developed it very well, and it has been integrated into Chinese medicine. But the thing with pulse diagnosis is that, at least in this system, it is a very exacting step-by-step journey into a pulse system that goes at least back to the Ming Dynasty. And it's been passed down from teacher to student since the Ming Dynasty. Keep in mind that there are now documented over 600 different pulse systems in the world. Each one tells its own story. Each one is very valid. This system, the Shen Hammer system, it really focuses on the organs. And from the organs, it extrapolates to the qi, the movement of qi. Jeffrey Yen has another very interesting pulse system. In that system, they focus on the flow of qi, and then they extrapolate to the organs. And it's just another way of looking at it. Okay? In China right now, a colleague of mine, who actually graduated from here, Brant Stickley, he's a professor at NCNM in Portland, who was a student of mine. He started with me in his 5th quarter here. He just returned from China, and he talked about that there's a movement now in China to reclaim their roots. You know, they realized that in the Cultural Revolution so much was destroyed or went underground. And now it's coming back up. And there's a real, and they realize a lot of it has actually come to the West. So they're wanting us to go over and teach. He just taught a course in Shanghai, which is where the Minghe School, or the Minghe-Ding School of Chinese Medicine originated. And that's the school that Dr. Shen in the 1930s attended. And the books all disappeared during the Cultural Revolution. Fortunately, they were not destroyed. And they are now in the process of being translated into English. They've been found, and there's still teachers around who have learned this. So there's, and in fact, in next October, there is a Pulse conference in China, and it's in a city just outside of Shanghai, where all the Pulse doctors are gathering to talk about their Pulse systems. There's a real push to bring the Pulse back into Chinese medicine in China. It's very interesting. It's very exciting. So the Shen Hammer Pulse system, which is out of the Minghe Ding family school of Chinese medicine, is just one system. But what you need, and what I have needed to do, is learn one system well. And then you can go and pick up other systems, but you're grounded in a system. And this system is, the Shen Hammer system is a very systematic system of learning the pulse. Everything that is taught in the system has been documented over and over again. So the beauty of it is that it has not lost its lineage. It has been passed down and continues to be passed down from teacher to student. What Dr. Hammer did after he learned this, he spent 18 years with Dr. Shen, is that he developed small classes which are very hands-on, and you practice and practice learning positions and all the qualities. And then you learn interpretation. And Dr. Hammer, he went to Cornell Medical College and then went to Cornell, then trained as a psychiatrist and also as a psychoanalyst at the White School of Psychoanalysis in New York City in the 50s. And it was with that, because he has such a strong psychological background, he has also brought his psychological training into and added it into an understanding of pulse diagnosis. In fact, in this book, there's a whole chapter just on psychological traits, as well as psychological, emotional, physical traumas. So you can read, you can actually feel in the pulse whether a person has been molested or raped or has had psychotic episodes, or there's schizophrenia, or extreme abject fear, terror. The combination of qualities in different positions will allow you to extrapolate to the possibility of these kind of problems that often patients will not talk about in the beginning. In fact, what Dr. Hammer found after 25 years as a psychoanalyst was that in taking the pulse, seeing a patient 3 times, taking the pulse, asking questions, taking the pulse again, asking more questions, doing 3 visits, he found that in those 3 visits he had more information about the patient than a whole year with the patient in analysis with him. And because he also learned how to treat people, an understanding of what to do, both herb-wise and acupuncture-wise, to help this person. Let's see here. According to Dr. Hammer, quote, "I came to realize the value of the pulse by observing Dr. Shen, who was seeing a new patient for knee pain." This patient came in with this about knee pain, and Dr. Shen took his pulse, okay, put him on the table, and put needles in him, and then was making up a formula, and he turned to Dr. Hammer and whispered in his ear, he has knee pain because he has tremendous guilt because he murdered somebody, and he gave the exact number of years. Well, Leon, who was a scientist, said, okay, this is documentable. You can document this. So he, with his skills as an analyst, he engaged this man after the treatment in a conversation about his life. And what he learned was, he's a Frenchman, and he was in the French resistance during World War II. And when Paris was about to be liberated, the order came down to kill all the resistance fighters. And his best friend, to protect his family, was going to turn in the other members of his cell. And to prevent that, this man killed him and has felt terrible about it. Well, that guilt has affected his kidneys, and as you know, the kidneys govern the knees. And it took X number of years to develop knee problems. And now, how did he get to that? It is not just the pulse. It's also reading the tongue. It's also facial diagnosis. Okay? And it's also listening to the voice, the sound of the voice. So pulse diagnosis is not in and of itself. Dr. Shen used facial diagnosis a lot of the time. There is a book by Timothy Mars. It's out of print. It's called Facial Diagnosis. If anybody wants it, email me. I'll send it to you. I have it in my computer. Okay? I'm happy to send you the information. Dr. Shen said that his book most closely represented his understanding of facial diagnosis than any other book he's ever seen, including the Chinese texts. Mars spent a lot of time studying Chinese facial diagnosis. So to continue quoting Dr. Hammer, over the years of our association, Dr. Shen has been able to demonstrate to me logically and reasonably exactly how he arrives at his conclusions. He was quick to point out that the interpretation of the pulse is influenced by body type, history, a perspective based on changes in the pulse over time. This is very important. His interpretations are therefore an integration of what is at his fingertips with many other elements and interaction and perception. Okay, so what I have found is and it will probably happen in the school at some point, is that there is such a push to learn pulse, because most acupuncturists will always feel this frustration in diagnosing. You all learn how to treat very well. You learn lots of treatments, but you don't learn how to diagnose. And that's what Dr. Hammer has focused on, is how to diagnose a patient, how to interview the patient, how to ask questions. Their answers. What are their answers? How do you interpret their answers? And that includes, part of that also includes their symptoms, and it also includes differential diagnosis as well. That is one of the very positive things that has come out of Mao's push for to have a dialectical imprint on Chinese medicine. So what I'd like to do is talk a little bit more. Actually, let me give you a couple of quotes first, just to whet your appetite. In a book called The Pulse in the Occident and the Orient by Reuben Amber, quote, "The Easterner uses the pulse as a very significant and direct diagnostic tool for the whole man, physical, emotional, and spiritual. Every other procedure is ancillary to it." A quote from the Sanskrit text on Ayurvedic medicine: "The learned physician should read the happiness and misery of the body, by feeling the root of the thumb, which stands as the witness to the soul. And then the Tibetan physician, Yeshe Dundon, he's passed away now, but I knew him and had talked to him quite a bit, is also quoted as saying about his training, quote, "But it was the mastery of the second trunk, pulse diagnosis, that was the hallmark of a leading physician." And according to Dr. Hammer, quote, "Because the pulse immediately reveals so much on an emotional level, pulse diagnosis has been for my patients an objective reading of their emotional state, which bypasses the usual resistance to interpretation that one encounters in psychotherapeutic practices." Okay, so what I want to talk about is depths first, just to give you a sense. So these are the basic depths. So let's say here's the skin, down here's the bone. So we have chi, blood, and organ depths. In reality, there is above the chi depth. So example, floating pulse would be above the chi depth. So floating pulse could be wind chill, wind heat, but it also could be liver yin deficiency uprising wind, which is very common. Most .com people who are working 70 to 90 hours a week have burned up their liver yin, and almost all of them have liver wind symptoms. Okay, so that's what you feel above the chi depth. There's other qualities like cotton. Cotton literally feels like a cotton ball, but you only feel it between the skin and the chi depth. And it's this amorphous resistance. And the interpretation of it, to quote Thoreau, is most people live lives of quiet desperation. So people who develop a cotton pulse, it's superficial chi stagnation. That's the diagnosis. Okay, it develops out of people in a situation where they're unhappy, but they feel helpless to make a change. It could be a bad relationship or marriage. It could be a sick child. It could be their own physical health problems. It could be unhappy in their job but don't feel capable of making a move. And actually, Dr. Shen has given us a formula for this, and it works. Sometimes it takes 3 months. I've had patients on it for 1.5 to 2 years before they were able to make a change in their life. But there is a cotton formula. It's very good. The chi depth, that's where you read the flow of chi and whether there's chi deficiency in the body. The blood depth, here you read the blood. You can read, like thin at the blood depth would tell us blood deficiency. Tight, wiry here would tell us blood yin deficiency. Okay? And then at the organ depth, we actually have the chi of the organ, the blood of the organ, and the yin or substance of the organ. And then below it are a couple of other qualities as well, which I'm not going to go into just right now. Well, maybe I can get to them. Here, just a minute. So there's the firm quality, which is here, and then the hidden quality. Okay? Usually this has a lot to do with stagnation and often with coldness, deep coldness. Okay, so this is not, I don't know how to narrow this. Just a minute. Oh, there we go. Great. Okay, so waves. In this system, there are waves. Now, I'm going to jump here for a minute. I will go back to this. In this system, we always feel the pulse with all 6 fingers first. This is where you feel the waves. Okay? So I'm actually reading all 3 depths, or 8 depths, as well as feeling for waves by feeling all 6 fingers. This gives me a baseline for when I go to all the individual positions. Okay? Now let's go back. Okay. So here's a normal pulse. It's a sine wave. It is narrowest at the chi depth and lightest. That's chi. And then as you go down, it expands. And then as you reach the organ depth, it expands even further and is stronger. This is a rare thing to find. Okay? In this system, there's another thing we do. Not only do we go down feeling the pulse, but we also feel the pulse coming back up. Okay? So not only do I go down, so as I come up, the pulse narrows at the blood, and then it's the most narrow at the chi. But you'll notice it doesn't go above the chi. Okay, that is a normal pulse. A flooding deficient pulse, you'll notice, it can go as far as the chi depth, but there's not a lot of strength in it. But most often, it develops somewhere between the chi and the blood depth. Let's go to here. Okay, that's a flooding deficient wave. That tells us already that a person, chi is deficient. This is a push pulse. There are 2 push pulses. This is one of them. This is pushing your energy beyond your pushing yourself, your physical body, beyond your energy. So at the end of any day, week, month, year, decade, decades, if someone is spending more than they're replenishing, okay, and this is what happens. This is physically pushing beyond their energy. This is a hesitant wave. This is mentally pushing beyond your energy. Most of you, by your end of your 2nd year, will have this. But it's temporary. But there are, because you're using so much mental energy. Okay, but it's temporary. You graduate from school, you start resting, relaxing, getting your chi back, it goes away on its own. Okay? But then you have patients who come in, like the .com people, or just people who are natural worriers. Okay? On the, are any of you familiar with the Enneagram? Okay, a 1. You understand that? Okay, so someone who is a 1, pretty much all 1s have a hesitant wave. Okay, others do too, other ones of the 9 also, but 1s especially. Overthinking, worry, obsessive worry, obsessive thinking, anxiety. Most of these people have this. This is mentally pushing beyond one's energy. Usually the pulse is more narrow, hard, tight. What does that tell us? More tendency to have used up their yin. So more yin deficient. Now, for some of them, it may be that underneath that is a constitutional yang deficiency. Okay, for some it's not. It's strictly yin deficient and their yang's intact. So what happens a lot is, and this is a concept that Dr. Shen talks about, he calls it nervous system weak, where people who are constitutionally, they're born without the strength, for whatever reason, of other people. So you think of a bell curve. Okay, most people, let's say 70% are here. But over here are the preemies, people with birth traumas. Okay, people who had, let's say, open heart surgery in their first year for whatever reason. Okay, so these people will tend to not physically have the strength, the constitutional strength, or yang strength to carry them when they move into the world. So in their teenage years, what do they have to do? They have to use their yin to move into the world. Traditionally, they used to call these people the neurasthenia, okay? People who are oversensitive, people who are tired. You'll see chronic fatigue problems in people, chronic fatigue symptoms, autoimmune diseases develop. This is where they are. Over here are the Arnold Schwarzeneggers of the world. This has nothing to do with intelligence. Some of the most intelligent people are way over here. Okay? The irony is people here often outlive everybody else if they learn how to live within their means, their physical means, so that they don't push beyond their energy. Okay? The people over here learn early on that they can push through their energy and get away with it using caffeine, drugs, whatever, alcohol, abuse, overworking. But they will reach a point often in their late 40s, 50s, maybe even 60s, where they hit a wall and they have no coping skills. You'll see this when you start treating people. Okay? There are other qualities. I'll give you an example. This is a flooding excess quality. You'll notice that it rises. It rises actually with force, and it goes above the chi depth. This is excess heat. Okay? It could be an infection. It could be just, if they're slippery with it, it could be excess damp heat. So slippery and tense would be excess damp heat. Slippery and tight, which you are not, from what I hear, like that's impossible, right? It is very possible. Okay, slippery and tight is dampness with excess deficient heat. So you can have extreme yin deficiency with dampness. Okay? So that would be excess deficient heat. Yes?
What was this wave on the hesitant?
It's a half wave. It comes up.
On
the hesitant. Oh, the hesitant is it's just coming straight up. There's no wave. So it's kind of like you feel it kind of just tapping on it.
Okay.
So it actually feels like this. If you have 3 depths, it's coming like this. Sometimes higher, sometimes lower, like that. That's the overthinking, worry. Okay? People in the extreme obsessive compulsive disorder. Okay? In the extreme. Okay. So this is, we only have so many minutes here. So this is just to give you a taste. Okay, qualities. I want to show you positions, because besides the 6 principal positions, which are pretty much similar to yours as you learn it, there is 22 complementary positions. So so the left distal position, look how that's being felt. You see it on the side. This is a principal position where you roll your finger up against the scaphoid bone. In this position on the left wrist, this is where you feel the heart pulse. On the right side is where you feel the lung position, the chi of the lung. You read the material aspect of the lung, laying your finger flat with your the lateral side adjacent to the scaphoid bone. And if this was on the right wrist, this would tell me about the chi of the lung and the flow of energy in the lung. But if you're reading, let's go to, give you an example, like large vessel, that you can read for, that is actually underneath the flexor carpi radialis. You have to push it aside. Normal here is you feel nothing. But if you feel tense and it's coming up, that's hypertension. If it's inflated, meaning it expands as it comes up, it could be an abdominal aortic aneurysm. Okay, very accurate. Mitral valve, you can read whether a person has a mitral valve prolapse. Okay, that's on the, you actually feel it on the pollicis longus on the left wrist. Heart enlarged. If you roll your finger, you can actually tell if a person's heart is enlarged. And you have to grade it from 1 to 5. There are 3 engorgements which tell us about blood stagnation. And these are off the principal positions. The left proximal tells us about the kidney. Okay, on the left side you're reading kidney yin, on the right side kidney yang, as a general rule, but a lot depends on the qualities. The large intestine position, look, it's on, in this system, and I found it to be very accurate, the large intestine is on the left side, the small intestine is on the right side. Very accurate. I once was called into Mount Zion, this must be a good 20 years ago, ICU, to try to figure out where this woman was bleeding. They couldn't figure out where she was bleeding from. And she had already had 7 or 8 units of blood. And I took her pulse. And what I found was a hollow quality. Okay, hollow. It was actually leather quality, and it was hollow. So I felt the chi depth. I felt this big gap here, and then I felt an organ depth. This, and it being very hard, tells me bleeding. And I felt it right where the transverse turns into the descending colon. And they couldn't believe me, and in frustration they opened her up the next day, and it was exactly where it was. And that's how I got hospital privileges. And it's true, that's what happened. You had a question? No? Okay. So just to give you, and that was on the left side. Well, basically what you do, so I'm in the 3rd position, I come up and I go 30 degrees in the distal direction. And you go medial to lateral, make sure you're on the artery. And that's where it is. Okay, then you feel that. And you can break that down into ascending, transverse, descending. Okay? The pelvis lower body, this is a very interesting position. So this is one of 2 positions where you lay your finger flat, where I drop my finger down like this. Okay? Here, I read from here to here. Okay? There is a quality in this system called muffled, which literally feels like, can I borrow your scarf for a minute? So if I have a cloth, so let's say I feel qualities here. There's no muffled. Let's say it's tense, it's slippery, it's pounding on a scale of 1 to 5, 2.5. Okay, so there's a little damp heat. So I put a cloth over it. Okay, drop my finger down. There's no change in those qualities or in the intensity. What happens? What happens is that it feels muffled. There's something between your finger and the qualities, okay? And you have to grade it, so like, this is a little thick, but let's say 1 to 5 layers of silk is how the Chinese describe it. Thank you.
Mm-hmm.
And 1 to 2 is the energetic stage. Let's say it's in a man. Well, muffled means growth or enlargement. So 1 to 2 will be at the energetic stage. The prostate is becoming enlarged energetically, but it's not physically there. A 3 is it's transitioning from the energetic to the physical. 4 or 5, they have an enlarged prostate. Okay? And then let's say it's a 4 and it's very slippery and tense and pounding. That could be a silent infection, prostatitis, that often men don't know about. They have it until it gets very bad and they have to start having pain. But they may have low-grade prostatitis for years. Yesterday I had a woman come in. Actually, she graduated from the school. She's practicing now. I took her pulse, and she had down there a muffled of a 3 and tense. Well, I told her she's in the transitioning stage of a fibroid tumor. But it hasn't actually formed yet until it's actually at a 4. But it's really about what's happening in her liver. Okay? There's a lot of blood stagnation. Fibroid is about blood stagnation and liver stagnation. Okay, now, if her pulse was not just tense, but tense and slippery and muffled, that probably would have been more an ovarian cyst forming. Because a cyst is damp, so you would have the dampness. But that's what muffled is about, okay? So that's one of the more common qualities that I feel. I have a patient came last week. He has cancer of the synovial fluid in his pelvis. I've never seen anything like this. I didn't even know about it. I had to go read about it. And he had a muffled of a 5. And he also had the dead pulse. Now, what's a dead pulse? A dead pulse is like putting your finger, pressing on a cadaver. And you know, you press into a cadaver and it doesn't come back. Okay? That's a dead pulse. Or like a piece of waterlogged wood. You press down and it doesn't come back. There's no spring in it. That's a dead pulse is cancer. A muffled pulse may be cancer, may not be cancer, but it is definitely a growth or an enlargement. Okay. This is just to give you a taste of some things. Yes?
Would muffled kind of in our system be the same as deficient or weak?
Deficient? No. Has nothing to do with that. You can have deficient weak with muffled. You can have excess with muffled. You could have yin deficiency with muffled. So a lot depends on what qualities are with it. Okay? The other pulse quality that I want to... Well, there's the neuropsychological position also. That tells us about... you can read head traumas. It's way up here on the... Actually, a crack in the it's on the scaphoid bone. And there's a quality where you can read head trauma. You could potentially read tumors in the brain. You can read if the pulse is doughy. Doughy, what's doughy? Doughy, we used to call it a galump. It's a quality that its sensation literally feels like dough when you feel dough. And whenever I feel a strong doughy, let's say a 3 or 4, I immediately go to kidney yang. That combination is almost always indicative of a constitutional yang deficiency. And those kind of persons are the most vulnerable to neurological illnesses like MS, Parkinson's, ALS. They are vulnerable for some reason to these kind of things because constitutionally they lack the yang and their nervous system is weak. Okay?
I have a quick question. I'm so sorry. So when you can feel the pulses, you can feel the beginning stages of possibly diseases. So you can treat them with Chinese medicine, herbs, and acupuncture in the hope that it does not manifest fully. Is that correct?
I'm sorry, I was looking for a physician. Ask me again.
That's okay. When you're feeling the beginning stages of diseases, like no matter what, whether you want to diagnose it in Western Chinese medicine, but when you feel the beginning stages, you treat with acupuncture, you treat with herbal medicine in the hopes that it does not progress, even for things like MS or things like...
Yes. Let's say, I don't tell a patient, well, you may get MS. I never do that. But I can see the dynamic. I talk about their constitutional yang is very weak. And in most of these people, their yin, they've used up their yin, so their pulse in the yin positions tend to be hard and narrow. So what do? I nourish their yin and support their yang. Okay? If it's winter time, I can get away with giving them some yang warming herbs. But if it's in summertime, I can't. I live in San Francisco. But I use yin herbs to start building the yin, and then a little bit of yang herbs that are not too heating, because they can't tolerate warming herbs. Okay. Does that answer your question? And it's long term. And one of the things to keep in mind is when you have a patient like that and you're having to nourish their yin, you tell them that the most positive result is that they'll start feeling more tired. And this can be very disconcerting because their yin is beginning to come back. And that means their nervous system is beginning to relax and they're being able to go from always in sympathetic mode into parasympathetic mode. Okay. One other thing before we run out of time is, okay, is that most qualities are, they say tense, bowstring, right? Well, it's actually a continuum from taut to tense to tight to wiry. So taut is the least hard and the widest quality, but it's a hard quality. These are all hard qualities. And so what happens? Taut is emotional stagnation. It usually starts childhood into teenage years. Okay? So that kind of chi stagnation, what does the body want to do? It's going to generate heat to move the stagnation. Okay? Over years, that heat starts injuring the yin, and the yin starts burning up. So the pulse gradually becomes tight, which is yin deficiency. Over more time, this is excluding methamphetamines and things, which is the direct route from taut to wiry, that yin essence becomes very deficient and the pulse becomes wiry, which is yin essence deficiency. Okay? So it's actually a continuum, and the treatments are different. Tense is about 50% chi stagnation, 50% excess heat. Taut is mostly chi stagnation. Tight is yin deficiency, but within yin deficiency, there's still chi stagnation. Wiry is extreme yin deficiency, or what we call yin essence deficiency, especially in the kidney. But within that, there's still chi stagnation. Keep that in mind. And if it's pounding, then there's a lot of deficient heat as well. Okay? Another quality that we have found is the leather quality, which is kind of a subset of tense. It's just harder than tense, but it's no, it's not as narrow as tight or wiry. Okay? Now, leather hard at the organ depth, we've seen a huge increase in this. It can be radiation or electromagnetic fields, a lot of exposure. And we're seeing more and more of that. Okay? But it can also be indicative of cancer if it's at the organ depth. Okay? I had 2 cases. I was in Delhi. This must be about 8 years ago. And I was asked to go see 2 people who were not feeling well. And it was more about hypertension. And I felt this leather heart. I'd never known it. Never felt it at the organ depth before. And in the liver, it turned out that the 2 of them had tumors, cancerous tumors in the liver, and within 2 months they were both dead. But it taught me something, and I took that information, gave it to Leon, and suddenly Leon started feeling it, and all the other teachers started feeling it. You know, it's like the 100th monkey effect. And so this system is not static, it's ever growing. After Fukushima, we started feeling much more leather hard in pilots and airline stewardesses who fly a lot, or people who fly a lot, because a lot of the radiation is sitting up at 30,000 feet. Well, that's where the planes fly. Okay? So empty at the chi depth. What is empty at the chi depth? Empty at the chi depth is like this. You have a chi depth, but the blood depth and the organ depth are either breaking up in the middle or they're not there at all. And it's very hard at the chi depth. This is the Viagra pulse. In other words, older men who are having ejaculations at an age where they shouldn't be anymore. Basically, in Chinese medicine, they say over 60. Okay? Or too much sex. I saw this during the AIDS epidemic when a lot of gay men were using amyl nitrates and having multiple orgasms. And they were just burning up their yin so much. And that's what this is. The yin is burnt up. But now with Viagra, you're seeing this at all ages because so many people, even younger people, are using it. So that's why we've nicknamed it the Viagra pulse. And then hollow. Hollow is like this. You have a hardness at the chi depth. It's breaking up or not there at all in the middle. And then hardness at the organ depth. This is hemorrhaging. Okay? So a quality could have many different meanings depending what you feel it with. Another thing, interesting thing about the muffled quality. I talked about muffled in the pelvis lower body. But if I have muffled in the heart position, that tells me about lack of joy type of depression. If it's in the heart. It has nothing to do with a tumor or a growth. It has to do with lack of joy type depression, if it's in the heart position. So a lot depends on where the quality is felt and the interpretation or the combination of qualities. Okay? Questions? Okay. So,
are you going to teach us a class? Are you going to teach a
Yeah,
class here?
how do you learn?
unfortunately, I had because of an illness in my family, I've had to cancel my class here for this fall. I'm teaching in Vancouver, but that class is already filled. It's all Chinese doctors from China, the whole class.
Oh.
And yeah, the Chinese are really, I've taught this in Taiwan with an interpreter. It's actually on YouTube, the class, with an interpreter.
What is the name of the video?
If you Google my name,
Okay.
you'll find it. The other thing is this book, the handbook. This is the abbreviated text of this book, okay? But this is a good beginning because you can get absolutely lost in this one.
Yeah.
Now this one has now been translated into Chinese by a dear friend of mine from Taiwan. In fact, the doctor that sponsored me in Taiwan. And I'm trying to get, I'm in the process of trying to get the texts, this book in Chinese, shipped to me from Taiwan. It's sold out. They've gone, in 1 year, they've gone through, I don't know how many printings, and it keeps selling out as soon as it becomes available. Most of the books are going to China. We're hoping to start teaching in Shanghai sometime next year. Yes?
Does anyone else teach this system in the area?
Yeah, in this area, no. No, I'm the only one here. My colleague, Brant Stickley, is up in Portland at NCNM. But that's it. Everybody else is on the East Coast, and there's one person in Milwaukee.
Okay.
And if you go on the Dragon Rises, if you go to Dragon Rises seminars, if you Google that, you'll see the classes.
So you're not teaching no one this weekend?
I'm sorry, what?
This weekend? I think there's-
No, I've had to cancel that
Okay.
due to an illness in my
Yep.
family. Yes?
Do you have plans? You know,
Yes,
for
I'm
the
going to
next
be
time?
teaching it starting in mid-February. I'm going to try and time it so that it's not before your midterms or finals.
We appreciate that.
Yeah, I've taught a lot of students. In fact, a number of my students are now teachers. Brant Stickley, Hamilton wrote, he's down at the Dragon Rises College of Oriental Medicine in Gainesville, Florida. They're now actually teachers. And they both started in their 5th quarter with me back in, I think it was '96. And as soon as they graduated, it just happened to be the same time that Dr. Hammer was starting that college. They just packed up and drove to Florida. And started assisting Leon and studying with Leon and teaching for him. But they regularly took courses throughout their time here. The other thing is that the feedback I get is that people who learn this system, when they graduate, they actually have successful practices. And it's very, because they know how to diagnose. You learn how to prescribe very well. And you learn the basics of differential diagnosis. But you know, people come in with so many conflicting symptoms. How do you put it together based on differential diagnosis? That's where the pulse comes in. So it's like you cut through all these myriad of symptoms and you can see what's happening in the pulse. So yeah, I'm going to start again I'm hoping to do it in mid-February. I'll do mid-February, mid-March. I don't know when your finals are. I'll look it up on the calendar. So I'm not doing this right before finals.
Will
Yes.
it be at the school, at our school?
No, I usually teach this in Berkeley. I rent a classroom at a place near, it's on College Avenue, right by the Ashby Theater.
Okay. And then how do we get on the mailing list for that information?
Here's my email,
Okay.
blaforgia@gmail.com. But I'll also have someone probably put it in all your mailboxes. Do you still have those kind of
Yeah.
boxes?
Oh, yeah.
Okay, so you'll get a flyer. I'll try to get I'll know by December when I'm actually teaching this, and I'll get flyers. I hope to get flyers in there in
Okay.
December.
Thank you.
Okay.
Most of us are like, we're all at different levels. I'm a first year, I just finished my first year. So for right now, and I took one, maybe two classes on pulses. What would you recommend for us that are just trying to just feel subtle changes? I mean, that's where I feel like I'm at right now. I mean, you just keep feeling different pulses, or just...
Well, once you learn the basics of the system, because the introduction is 4 days, it's two-day weekends, which really needs a third 2-day weekend to really have a sense. Then you can actually know how to feel qualities. What I would do is feel the pulse both going down and coming up. Feel whether it's taut, tense, tight, wiry. Feel for slippery. Now, slippery is only in one direction, the direction of the blood flow. So it goes this way. If you put your finger down and you feel slippery going both directions, that's just the body, the artery responding to pressure. It has nothing to do with slippery. So slippery is just something sliding across your finger. And you can feel that with tight and wiry as well. If you could just do that, that's fantastic. The other thing to keep in mind, let me show you, no, actually the picture here is not so good. When you feel so when you come up, there's 3 things to look for. So one would be, so normally a sine, you're thinking of a sine wave where it, as you go down, it expands and gets harder. More force. As you come up, it narrows and there's less force. But then as you come up, if you feel something like this, that's blood unclear. If you have blood unclear and the rate is in the 50s or low 60s, that's usually toxicity, heavy metals poisoning. Okay? If it expands, like this, but it still goes back to a normal sine wave, that's excess heat in the blood. Remember, this is the chi depth, the blood depth, the organ depth. Or it can go like this. This is excess heat toxins also in the blood, often due to high cholesterol, fats, lipids, eating a lot of shellfish, wine, rich foods. So usually these people have high cholesterol. Okay. But that's, you only feel these when you come back up. And so what are we doing? We're reading the blood when we come up. We're reading the chi as we go down. Okay? So that's something else to feel for. Those are the best things you could do. I do recommend if people take my class, don't start your first year. Wait until you're in your 5th quarter. Okay, most of the people for some reason really have mastered it, started their 5th, 6th, 7th quarters. A few have done it later on, but the majority have started around their 5th, 6th, 7th quarters.
A better understanding.
Well, you got to have a foundation. I start talking in Chinese terms and interpretation. You need to have something there, so it's not cold. Okay. Any other questions here? I know it's 1:30. Yes.
Earlier you said that there are patients who have like chronic prostatitis, but it's really low level and they're
silent.
Yeah, like how would their pulses look like?
Okay. Their pulse here in the pelvis lower body.
Mm-hmm.
So basically you're in the kidney position, then you drop your finger down, and you feel it on the first digit, just from the tip to the first digit. You just lay it flat. Then go medial to lateral. Make sure you're on the artery. Often the artery is very medial here, especially in women. So you kind of, sometimes you have to push the tendon, the flexor carpi radialis, in the medial direction to find it. Okay? And then you'll feel, in a man, it'll be muffled, tense, slippery. And that is often, and let's say the pounding's only 2 to 3, then that's often a low-grade prostatitis that's silent. Okay? If it's 4 to 5, they have a full-blown infection, but they'll know about it.
Yeah. Because I have a patient, he has a real graduating high PSA level growing, but there's no benign enlargement or anything, so like.
It could be infection.
Yeah.
Sometimes PSA is high because of a low-grade chronic infection.
Okay, I'll see if I find something.
Okay.
Yeah.
Yeah. Okay, well, thank you very much.
Thank you very much.
Where are you in your class? In your quarter, what week is this about?
It's like the third week.
Oh, it's just the third.
Now transition semester.
Oh, you're in semester?
No, 15 weeks.
Yeah, it's trimesters. With the merge of CIIS, we had to
Yeah.
change the schedule.
Yeah, I gave a talk to the Alumni Association about a month and a half ago. And it was at CIIS. Well, I hope that works out. I hope.
Yeah, so do we.
One of the things that, Dr. Hammer has in this book more, a whole chapter on, just a second here, qualities as signs of psychological disharmony. There's a whole huge chapter here. Example. I'll go to the beginning here. Depression, grief, melancholy, anguish, sadness, and he breaks it down how to read the qualities and tell you about it. Psychopathology, kidney essence weakness, which is often the root of a lot of this. And he has a book called Dragon Rises, Redbird Flies on psychology and Chinese medicine. It's a very difficult read, but at some point it's worth it to read that book. My colleague up in Portland, he taught this book with Dr. Hammer at the college, and now he's starting to teach it. He's already started to teach it in Portland, and I'm trying to get him down here to teach it here as well. So he talks about like primary analytic depression, cyclothymic depression, agitated depression, hysterical and reactive depression. And he goes in, he talks about the qualities. The lack of joy, that's that muffled in the heart position. Flat, there's a pulse in the distal positions, which is the heart and lung. If the pulse is deep, but there's no, when you feel a pulse, you get down there, even a deep pulse, it kind of engages your finger, okay? But this pulse doesn't engage your finger, and it would be in both positions, okay? That could be some kind of loss or profound disappointment before the age of 12 to 14. And you can read this in there. I've found it to be very accurate. But also it could be the umbilical cord wrapped around the neck. That would cause this as well.
Would you feel that in the person or the mother?
You feel it
she's
in
pregnant.
the patient.
In the patient, okay, wow.
Right, if it was happened to them as a baby, and when they were their birth.
Wow.
Okay, if they were butt first or feet first, everything got pushed up this way. So then that position would be inflated. So an inflated pulse is like this. It expands as you come up. These people often end up with hypertension later in life unless it's been treated, and there's a way to treat this. Okay? Let's see, postmenopausal syndromes. bipolar, Graves' disease, anxiety, and they talk about all the different aspects of anxiety and how to break it down and what organs are affected. Okay? And usually that's the heart, liver, kidneys. Okay? Talk about the different aspects of heart sheath efficiency. Worry. You know, we talked about the hesitant way. Another one would be, you know, fear, types of fear. You know, fear in the heart, blood stagnation. Profound guilt and fear, like that man with the knee. And you can read this. Consistent rough vibration over the entire pulse at all depths. That's often some kind of trauma that's happened, usually early in life. However, if you feel a strong rough vibration in the kidney position, or maybe sometimes even the pelvis, lower body, that could be molestation, that could be rape. And I've diagnosed that many times. And then there's the delicacy of how do you bring this up with the patient. Okay, I often don't bring, if they didn't come in with this kind of thing, I don't necessarily bring it up the first visit. Part of the art is when to give people information and when to hold back until you've developed enough of a relationship with that person that they can actually hear this. And then talk about treatment plans that can help them. Okay? So a lot of people will do therapy in our culture, lots of therapy, but they still feel as if it's still in their body. Now there's, you know, they've developed somatic body work to help with this, which does help. Body dynamics is another type of therapy out of Denmark that works with this. But still often it's in their body. Well, there's a whole protocol using variations of Shen Hammer. Are you familiar with that formula? And Yunnan Bayao, where the Shen Hammer works on the body level, the emotional level, and the Yunnan Bayao works on the physical level to move shock out of the body. And I usually don't do this with patients unless they're also in therapy in our culture. You know, Leon sometimes would just put people on this and just, okay, come back in 3 months, just stay on it. But there's a protocol on how to use it. Okay? So, you know, it's a wonderful system, and Dr. Shen also has these types of formulas that work with people who are constitutional nervous system tense versus nervous system tense due to life, and there's a way of determining which one. You know, it's a hypervigilant pulse. So most people in the Mediterranean basin, Italians, Greeks, Arabs, Jews, have this pulse, and from birth. And it's where all positions are either tense and or tight, the principal positions, and the rate is on the slow side. And these people, in order to survive, learn to be very hypervigilant, so they're always on. Okay, so I mean, I'd say the people that I see the absolute strongest are the years ago, I saw a lot of Holocaust survivors, and I mean, many of them have passed away, but their children also, it's passed on. And there was an article a couple of weeks ago in the New York Times documenting now that hypervigilance is actually passed on to the next generation. And you know, Leon and Dr. Hammer and Shen have been talking about this for a very long time. So that just to give you a flavor. That's my job here today, is just to give you a flavor of this. Okay? All right, any other questions? Yes?
For that book you talk about, you say you have the Chinese version and English version, and which one would you recommend us to read if we can do
Well, my Chinese is not good enough to read the Chinese edition, so I can't vouch for it. However, I know the translator, and he is really bilingual, and he's also a linguist. He really knows language. And from Chinese friends of mine who have read parts of it, they said it's very well done. Okay? So, I mean, that's up to you. I mean, you're here in America. If your English is good, I would say read the English edition, but the Chinese edition, if your English is not as good, the understanding will come then through the Chinese edition. The people up in Vancouver are all from China. And then, they all want the Chinese edition, but half the class doesn't speak very much English that I'm going to be teaching in October. So I suggested the Chinese edition. If you want the Chinese, let me know, email me, and when I get it, I can let you know that it's in. Okay? Yes?
Dr. Shen, did he use the five, this is probably a very big question, the 5-element theory for psychological, spiritual?
Leon does a lot.
Okay, that's Dr.
But Dr. Shen, to my knowledge, did not do that. Now, the 5-element system, as taught by the Worsley School, is basically made up by Worsley. He did a brilliant job, but basically he brought in Western psychology, psychoanalysis, theories on homeopathy, and 5-element acupuncture that he learned, I believe it was in Taiwan.
I did not know that was me.
Okay, but there's nothing in the literature, okay, on what Worsley teaches. But it works for some people.
If you had time and you were willing, I was wondering if you'd share a story, a profound story if you had one.
A profound story.
I mean, the one you shared with the hospital is pretty amazing, but.
Yeah, and the liver cancer in the hospital.
Yeah.
Well, I told you a story about the knee,
Mm-hmm.
Dr. Hammer's story there. Yeah, I'll tell you a good story. We talk about the mitral valve and reading a mitral valve prolapse. You actually feel it on the left. It's just directly lateral to the heart special lung position. And you feel it on the pollicis longus, and you feel it superficially. You feel it about 45 degree medially and 45 degree laterally. So basically it's if you think of let's say this is the tendon. Let's say this is the tendon. I feel it on top superficially, 45 degree medial, 45 degree lateral. It could be in any of those three positions. What you do though is, so it's the upper 180, and you do not feel the lower 180 because you'll definitely feel sensations down there. So it's a very light touch. Well, I had this woman come in who she couldn't get pregnant. She had one child and wasn't able to get pregnant. And when I felt her pulse, this was on a scale 1 to 5, slippery of a 5. Well, that's mitral valve prolapse. So I sent her off to see a cardiologist, because with HMO though, her doctor would not give her permission, said it was ridiculous, she didn't have the mitral valve prolapse, which he was actually technically correct. So it came back, and on a scale, 2 weeks later, scale 1 to 5, it was a 6. Sent her back, you need to see a cardiologist. They wouldn't give it, wouldn't allow her because it was an HMO. And this went on for a few months, and I felt it getting worse. And I said, there's a problem here. There is blood going between two chambers of the heart. I assumed it was mitral valve. Well, she ended up, I said, you have to demand it. You just have to push them. And she got it finally. And she went in there and finally got to see a cardiologist. She was in open heart surgery that night. It turned out it was not a mitral valve prolapse. She had a hole in her heart, a congenital hole in her heart, but it had a very thin layer of muscle over it. But with the pregnancy and birth of her first child, it tore. When the doctor talked to her after surgery, said there was actually a 1/4 of an inch left, and it was just flapping like this. And if that tore, she would immediately die.
Wow.
They got it just in time. Yeah. So you know, now we know it's also could be a hole in the heart that's leaking besides a mitral valve prolapse.
Wow.
So, actually, I've seen 2 cases like that. The second one I was able to diagnose it faster. So that's where experience comes in, and seeing lots of patients and making mistakes. You know, you don't, you know, you're not going to get everyone right. And sometimes, you know, it's just that you and the patient are not a good fit. It has nothing to do with your skill level sometimes. It's just, it's not a good fit. That happens. So one of the keys is getting experience, making mistakes, and learning, really trying to learn from your mistakes. Okay.
One more comment.
Sure.
I know for me, sometimes what creeps in is a little bit of doubt. I'm 33 and I've just started studying medicine, and it feels like this medicine is so vast, so wide. It's like, am I fooling myself to believe that I can get to a level of understanding that can even, you know, that can diagnose or just be good?
Oh yes, definitely. 33 is young enough to do it. Yeah. Because you'll have your...
Where's the cutoff?
There isn't a cutoff, although I had a couple of people in their 50s and 60s approach me over the years, and I recommended, no, you know, stay with what they're doing, or Chinese medicine is vast. And not only that, you're practicing here in the West. You have to learn nutritional medicine, and nutrition and supplements, and understand them. You have to really know interaction of herbs and pharmaceuticals. You know, this is stuff I've learned along the way. When I started practicing Chinese medicine in the 70s, 22% of the people in this country were on a prescription medication. It's now pushing 77 to 80% of the population are on pharmaceuticals. I spend a lot of my time weaning people off of pharmaceuticals. Okay. There was no SSRIs or SSNIs. And now there's a whole new batch of antidepressive medications about to come on the market as well. You know, and Lord knows what those side effects will be. Not that they don't have their place, they do. But in a lot of cases, you can actually help people get off them. And then there's exceptions. There are people that really, truly need to be on it. But you have to know drug interactions. Very important. And you got to know supplements. I have patients now that walk in with, I've had 2 big shopping bags of supplements, because the naturopaths and some integrative MDs are now, that's what they do. Well, supplements can be very hard on people with weak spleens. And most people in this country, because of their diet, have weak spleens, cold, damp spleens. And and you got to learn how to educate a patient, you know, about all of this. One of the interesting things, I've taught the Chinese up in Vancouver now. I think I've taught 4 or 5 classes. I've been asked every class, and these are, some of these doctors fly in, some have immigrated to the Seattle, Vancouver area. Why do Westerners have such poor digestions? They've never seen anything like this in China. And I describe the diet, you know, the ice cream, the raw foods, the smoothies, the the amount of sugar that, you know, kids are exposed to. And their jaws drop, and they say, well, everybody knows that's not good for you, raw food diets are not good. Everybody knows. I said, within your cultural paradigm, yes, but it's actually a big movement. You know, if you do a raw food diet cleanse in the spring or in the early fall for 2-3 weeks, great, it's very healthy for you. No problem. It can be a very healthy thing to do. Then you stop and you go back to warm foods diet. But people, I get people, they've been on raw foods for months and months. They go through a winter on raw food. They're complaining of being cold and lethargic. You know, and you try to explain to them, oh, no, look at this. You know, they write about this. And I said, yeah, but they're wrong. This is the third wave of raw food crazes that I call it, since I've started practicing in the late 70s. But this one is sticking around. It's now, even doctors are recommending it. I can go on and on. Okay, thank you very much.
Thank you very much.
Thank you.
Thank you very much.
I sent you an email about the book,
Well, what's your name?
but Linda, I just need to see it, so don't worry about it.
I can get it for you.
Yeah.
Do you mind if I take a picture of the books?
Yes. I mean, no, I don't mind. Hold on. Let me write your name.
Sure. Okay.
What's your, it's Linda, what's your email? I'll get it to you.
Oh, great. It's Linda dot B dot Wu, W-U.
Okay, so you want the
Gmail.
facial and the
That'd be good.
Dr. Shen's book.
Sure, that'd be great. Thank you very much. Appreciate your time.
Thank you.
Take care.
Can I get a copy of that as well?
Yes, go ahead.
Should I, do you want me to?
Yes.
I'll just go by.
Can I get a copy of the Timothy Marks official?
Yes.
And that's my email.
Okay.
And if the Chinese books comes, can you let me know as well?
Okay, I'm going to write this on the card.
Okay.
So I'll remember. Okay, let me make sure I can read it. Patricia,
Kim,
Kim,
08
Thank you very
at
much.
Gmail.
Bruce is at Gmail as well.
At Gmail. Okay. What is this F underneath it? The next one?
I said as well.
As well. Oh, okay. Okay, so we want,
You can cross that.
you wanted the book and,
In Chinese. Is the English one in Amazon?
this one, yeah.
Do you have a website?
I'm about to build one.
Okay, so it's not up yet.
It's not up yet. But if you go to the Dragon Rises seminar, Google Dragon Rises seminar, and they have all the information about classes and articles by Dr. Hammer.
Okay.
Okay?
Yeah, I was just curious about your background and so.
If you go to Dragon Rise, there's an autobiography.
Okay,
A
great.
brief biography. You
Nice.
Put a brief
Yeah,
biography.
I can tell you're from New York though.
Yes, I am.
am.
Can't take it out of me.
Okay.
Book in Chinese plus.
I'll put my name.
Yes.
I'm just gonna put my name down.
And where is your practice?
I'm in San Francisco in the Medical Arts Building. It's on the corner of Van Ness and Jackson. Jackson.
Like Chinatown and go up, like Jackson Street, go up.
Yeah, go up Jackson to Van Ness. I'm right there in the corner.
Okay, okay. Because the patient I talk about, I think if I felt something, I might send him to you to see if there's
Okay.
because his doctor recommend he a biopsy, but he doesn't want to do it. But
This
he's
is for the
concerned.
prostate?
Yeah, he's
What's his
concerned
PSA?
42.
42? I would get a biopsy.
I'll ask him.
Yeah, 42, the odds are it's cancer
I see.
already.
Yeah, because they do physical exam, there's no enlargement, no pain, no burning.
If it's 42, he needs a biopsy.
Okay, I will tell him that.
All right.
Okay.
Yeah, that's where, you know, Western medicine has its place.
Okay, so what is the cutoff that you would say, go get a biopsy for the PSA?
Oh, well, Western doctors will say probably 6 or 7. I mean, you want it to be under 4, 4.0 of PSA. So if it's above that, then you have to see is there a family history of it being high, but no cancer. If there's no family history, then get a biopsy.
Okay, because he says every 2 years he got examined, he's gradually going up.
Get a biopsy at 42.
Okay,
PSA is 42.
yeah.
I mean, don't tell him he most likely has cancer.
But
But tell
ask
him
him to
he
go.
needs a biopsy.
Okay,
He really does.
okay,
I mean, that's, if he came to me, I would tell him, you have to get a biopsy.
okay. This is-
And not that a biopsy always gets it, because it could be in an area where the needle doesn't get to. But they,
Class and math, I think the physics homework.
the odds are,
Could you, do you mind looking at
unless he
see,
has a
is there a
very
class in here
severe
in the next hour and a
infection.
half? Is it fair?
I don't think so, there's no symptoms of infection.
Then
No class in here until
they
5:30?
get a biopsy.
Yeah,
I'll probably
unless,
stay in here then.
How
like
old
we
is he?
Till 3:30, I have to go to the other campus. It is kinda cold in here, huh?
I saw 2 patients.
Is that, it's because the door's open?
Like 50s to 60s.
I might set
around
up on
that
the
age.
massage table and sleep.
Get a biopsy.
Okay, I'll tell him.
Yeah. No, they really need to.
Do you have a business card? Just
I
in
forgot
case?
to bring them.
Okay.
But that's my email.
Okay.
I can give you
Got
my
that.
phone number if you want. My
I
office.
saw it here and I took a picture. If you don't mind, I did it.
Yeah, that's fine. That's my Marin number. But that's okay.
Okay,
And my secretary checks both.
okay.
All right, thank you.
As you gather, I'll ask you a question about fasting. I know TCM doesn't recommend fasting. What are your?
Well, actually, there are traditions in Chinese medicine that do recommend doing fasting. It can be very healthy for you.
Yes, yes.
But it's just, it depends on the school of Chinese medicine. Okay, these other schools of China are beginning to come out again.
Oh, right.
And there's one school of Chinese medicine that comes out of Taiwan. Now, whether it came from China to Taiwan,
Right.
I don't know. Thank you. But they recommend doing, and it's very prescribed, we use Chinese herbs as well.
Mm.
So, but then there's, what time of year are you gonna fast?
Yeah, right.
So the door is open at different times of year, so like spring is a discharge season. Okay, it's more physical discharge within that there's emotional discharge. Autumn is more emotional discharge, but within that there's physical discharge. Winter and summer are more building seasons. Okay?
I was in the military for a long, for about 8 years. Before I finally got a chance to start studying TCM. But at 24, I was going through a lot of stress, a lot of whatever. And it just dawned on me, we'll try it fast. I was looking up, because I was a runner, I was running these things, but nothing seemed to just relieve the stress. But anyway, I tried my first fast. I did a juice fast, and it changed my life. It's 7 days. And after that, then I realized, like, after a year of the fast, my body just kind of went, maybe I should fast twice a year. And I didn't, and it just, but this year is the first year that I didn't do it because I started school and I was tired, and I'm thinking I want to do another one. But it would always be, it just fell that way. It would always be in the spring, like March, and then October. But that just happened to fall like that. But anyway.
April's better.
April's better.
April because it's still a little too cold.
Mm-hmm.
And liver season, you know, it depends if you use the Chinese calendar or the Western calendar, but April's a good time. And then early October.
Early October, right.
Because it hasn't gotten cold. Because,
Right.
you know, you do a fast like that, you get cold.
Right.
So those are good times to do it. But keep your bowels, make sure your bowels stay open.
Okay. But bowels?
Bowel movements.
Oh, I've always had kind of issues with
Yeah,
that.
but see, some people get plugged up.
Mhm.
And and then the toxins can't come out. The toxins are released, but they can't come out. And also perspire, because it comes out. Think of the skin as the body's largest organ. So it's perspiring, dry skin brushing, baths with baking soda, Epsom salts, things like that. Help pull the things out.
Thank you so much.
All right. Thank you.
We need to turn the camera. Did anybody turn the camera?
Oh,
Just thought of that.
what do you do?
I don't know. Should we call Michael in or should we just do it?
Stop.